Let us now learn about suboccipital triangle. It is triangular intermuscular space situated deep in suboccipital region of neck. It is triangular intermuscular space. It is present in between muscles. Hence, it is triangular intermuscular space situated deep in suboccipital region of neck. It is situated in suboccipital region of neck. Boundaries of suboccipital triangle: superomedially rectus capitis posterior major, supplemented by rectus capitis posterior minor. You can see this is suboccipital triangle. Superomedially, this is medial side, this is lateral side. Superomedially rectus capitis posterior major, supplemented by rectus capitis posterior minor. It is straight rectus. As suboccipital triangle is present posteriorly, remember posterior. It is long, hence remember it as major. It is short, hence remember it as minor. Rectus capitis posterior major supplemented by rectus capitis posterior minor. Superolaterally, obliquus capitis superior. You can see this is lateral side. Superolaterally, obliquus capitis superior. Inferiorly, obliquus capitis inferior. Superolaterally, obliquus capitis superior. Inferiorly, obliquus capitis inferior. Superomedially, rectus capitis posterior major supplemented by rectus capitis posterior minor. Superolaterally, obliquus capitis superior. Inferiorly, obliquus capitis inferior. Roof: it is formed by dense fibrous tissue covered by semispinalis capitis medially, longissimus capitis, and splenius capitis laterally. Splenius capitis laterally is present occasionally. Roof is formed by dense fibrous tissue covered by semispinalis capitis medially, longissimus capitis laterally, and occasionally splenius capitis laterally. Floor is formed by posterior arch of atlas, posterior atlanto-occipital membrane. You can see this is posterior arch of atlas, posterior atlanto-occipital membrane. Atlas is C1 vertebra. Atlas is C1 vertebra. Axis is C2 vertebra. Do not get confused between atlas and axis. Atlas is C1 vertebra. Alphabet T comes first. Atlas C1 vertebra. Alphabet X comes later. Axis is C2 vertebra. You can remember in this way. Contents of suboccipital triangle: suboccipital plexus of wings, suboccipital nerve. Suboccipital nerve is dorsal ramus of C1. Greater occipital nerve. Greater occipital nerve is medial branch of dorsal ramus of C1 nerve. And third part of vertebral artery. Third part of vertebral artery, suboccipital nerve, greater occipital nerve, and suboccipital plexus of wings. Suboccipital plexus of wings. It connects the following ways. It connects muscular veins from neighboring 6 muscles, occipital veins, internal vertebral venous plexus, condylar emissary vein from sigmoid sinus, deep cervical vein, plexus of veins around vertebral artery. Muscular veins, occipital veins, internal vertebral venous plexus, deep cervical vein, plexus of veins around vertebral artery, condylar emissary vein. Suboccipital nerve. It is dorsal ramus of C1 nerve. Dorsal ramus of C1 nerve is suboccipital nerve. It emerges backwards. You can see this is posterior side. It emerges backwards between third part of vertebral artery and posterior arch of atlas. It emerges backwards between third part of vertebral artery and posterior arch of atlas. It ends by giving muscular branches to obliquus capitis superior, obliquus capitis inferior, rectus capitis posterior major, rectus capitis posterior minor, semispinalis capitis. The branch to obliquus capitis inferior gives a communicating branch to greater occipital nerve. Suboccipital nerve does not give any cutaneous branches. The third part of vertebral artery appears in the triangle by passing through foramen transverse cerium of the atlas. The vertebral artery is separated from posterior arch of atlas by first cervical nerve and its dorsal and ventral rami. You can see here this is posterior arch of atlas. Over the posterior arch of atlas, first cervical nerve and its dorsal and ventral rami are present. Over this, vertebral artery is present. Hence, the vertebral artery is separated from posterior arch of atlas by first cervical nerve and its rami. The vertebral artery leaves the triangle by passing deep to lateral edge of posterior atlanto-occipital membrane. You can see here the vertebral artery is passing deep to lateral edge of posterior atlanto-occipital membrane. Let us now revise suboccipital triangle. Boundaries of suboccipital triangle: superomedially, rectus capitis posterior major, supplemented by rectus capitis posterior minor; superolaterally, obliquus capitis superior, inferiorly, obliquus capitis inferior. Roof: it is formed by dense fibrous tissue covered by semispinalis capitis medially, longissimus capitis laterally, occasionally splenius capitis. Floor: it is formed by posterior arch of atlas and posterior atlanto-occipital membrane. Contents: artery, vein, nerve. Artery, third part of vertebral artery. Veins, suboccipital plexus of veins. Nerves, suboccipital nerve, dorsal ramus of C1 and greater occipital nerve, medial branch of dorsal ramus of C1.